Differential diagnosis of secondary hypertension. Renal causes. Renal artery stenosis. In renal artery stenosis, hypertension is due to renin-angiotensin-aldosterone system, renal parenchymal disease, chronic renal failure. Chronic renal failure is associated with fluid retention. Endocrine causes. Cushing syndrome. Elevated cortisol levels are present in Cushing syndrome. Cortisol has mineralocorticoid activity, so it is associated with fluid retention. Cone syndrome, elevated aldosterone levels. Aldosterone is a mineralocorticoid. It causes fluid retention. Hyperthyroidism. Hyperthyroidism causes sympathetic overdrive, so there is increase in blood pressure. Hypothyroidism can also cause hypertension due to fluid retention. Acromegaly. Acromegaly is associated with insulin resistance. Elevated insulin levels are associated with fluid retention, so acromegaly can also cause hypertension. Congenital adrenal hyperplasia, 11-beta hydroxylase deficiency, and 17-alpha hydroxylase deficiency. Congenital adrenal hyperplasias in which there is 17-alpha hydroxylase deficiency or 11-beta hydroxylase deficiency, they are associated with hypertension. Congenital adrenal hyperplasia that has 21 beta hydroxylase deficiency is associated with hypotension. 21 beta hydroxylase deficiency is more common form of congenital adrenal hyperplasia. Primary hyperparathyroidism. Elevated serum calcium levels can also cause hypertension. Pheochromocytoma. There is pulsatile increase in epinephrine and norepinephrine levels in pheochromocytoma, so there are spikes of elevated blood pressure in pheochromocytoma. Cardiovascular causes, aortic dissection, aortation of aorta. Neurological causes, raised intracranial pressure. Raised intracranial pressure presents as classic triad, elevated blood pressure, labored breathing, bradycardia, pregnancy-induced hypertension. Substance abuse, amphetamines, phencyclidine, cocaine, nicotine, caffeine, alcohol. These drugs can cause sympathetic overdrive. Drugs related, oral contraceptives, estrogen. Estrogen causes increased systemic vascular resistance. Sympathomimetic drugs, for example, decongestants. Corticosteroids. Corticosteroids have mineralocorticoid activity. They are involved in fluid retention. NSAIDs, for example, celecoxib. NSAIDs are associated with fluid retention, so they can cause hypertension. Obstructive sleep apnea. Obstructive sleep apnea can cause sympathetic overdrive due to apneic episodes. Dyslipidemia. Dyslipidemia can affect arterial elasticity. Insulin resistance. Elevated insulin levels cause fluid retention, so there is elevated blood pressure. Non-alcoholic steatohepatitis. Non-alcoholic steatohepatitis can cause sympathetic overdrive due to oxidative stress. Thank you.